Bipolar disorder symptoms are going to be the same symptoms as depression, but you have to add some other things, the symptoms of mania. Mania, a lot of times people will say, oh, well, that's not a problem. I just feel really good when I'm manic. And that does affect treatment at times. But the symptoms of having mania would be that you would feel excited or elated, very, very happy, very interested in lots of things, feeling and acting hyper, lots and lots of energy for an ongoing period of time. A lot of times people will also feel very irritable, or they'll present as being very irritable. They have a hard time when people are pestering them, not reacting in an irritable way. They're easily distracted, hard time concentrating, very talkative, and they talk very fast. Increased self-esteem. In the field, we sometimes call that grandiosity, feeling like they can do anything. Lots of times they will do things that are out of character because they feel like maybe they have some kind of superpower, that kind of thing. The decreased need for sleep and not really missing it. People who can stay awake for days, sometimes a week at a time, moving, doing all sorts of activities while everybody else is like, please just go to sleep. Shopping sprees, spending lots and lots of money. These are folks who might buy a car. They might go and spend thousands of dollars that they didn't have on something that they didn't need or really say that they wanted before that happened or before they became manic. And other risky behaviors. A lot of times what we see is people who usually have pretty good judgment, becoming more sexually active with more questionable partners, doing other things that could cause them harm. And this can also include delusions and hallucinations, seeing or hearing things that other people can't see or hear, feeling like they have some sort of or special skill, so that could also be included. And a lot of times you see that in a person who's been manic for a while. As far as thinking about, when you listen to those symptoms, most of us will think, oh, well, I do that, or I do that, and I do that too. It's important to note that the human condition, part of the human condition is that our moods go up and down, and they are attached to certain things. It's natural to feel sad when someone in your family dies. It's also natural to feel very happy when something good happens in your life, like you get married or have a baby. That does not necessarily make a diagnosis. However, there are some other things, and that's one of the things that could be going on if you noticed that you had some of those symptoms or that you were feeling happier or more sad than usual. But there's also some other things that could be going on that you would want to make sure to think about and to bring up when you were talking with your doctor. A mood disorder due to a medical condition. There are a number of medical conditions that can cause people to look depressed or bipolar, not the least of which would be dementia. Also, there's a part of diabetes that we often will see a person who's had some trouble with their diabetes. They might look depressed or bipolar. And substance-induced mood disorder. This one is a very hard one because a lot of times people who have depression or bipolar disorder will utilize substances to try and help them feel better. However, substances can make us feel depressed or elated. So that's one of the things that your doctor or your healthcare provider is going to be really looking for, to try and tease apart whether or not this is something that existed before the depression or the mood problem, or if it's something that is coming on after using substances. There are a number of treatment options when you're talking about treating depression or bipolar disorder or any of the other affective disorders. The two big ones are talk therapy. When you're looking for a therapist, you're probably going to want to look for someone who's going to use at least some of the cognitive behavioral therapy techniques, because that is the one that's evidence-based for people with affective disorders. There are some others. DBT is one that has shown some efficacy with people with bipolar disorder especially, but certainly you're going to want to look into what kind of therapy is this therapist going to use with me. Also, medications are very helpful for people who have mood disorders. I caution people to remember that Not every brain is the same, not every depression is the same, and not every person is the same. So, and since we can't just take a test of your brain and figure out exactly which medicine is going to work the best for you, sometimes it takes a little time and a little bit of experimentation to figure out exactly which medicine will be the best for you. That's where you would want to bring your doctor into the situation. Some examples of the medications would be mood stabilizers, which are used a lot for bipolar disorder treatment. One of the more common ones is lithium. And antidepressants, which are used in both cases, Prozac and Zoloft would be examples of those. But of course, there are lots and lots of different mood stabilizers and antidepressants out there. Another school of thought would also say that there are certain antipsychotic medications that can be added to a person who is having some symptoms of bipolar disorder to help stabilize their mood, and that does seem to be showing some effectiveness as well. So don't be surprised if that's something that's brought up as an option. Also, I wanted to just kind of give a minute to talk about my sources. Obviously, I've worked in this field some, so some of this is just stuff that you kind of know. Also important to discuss would be if you feel like you need some more information, you can contact the National Institute of Mental Health at www.nih.nih.gov. That is the National Institute of Mental Health, and they have a wealth of resources online that could assist you if you thought that maybe you were having this problem, or if you felt like maybe you needed to research this for a loved one. Also, the National Alliance on Mental Illness, which is a very family-friendly, grassroots type of organization. Their website is www.nami.org. They have lots of support information for families. They have groups that families can get together, support groups, and work toward helping their loved one. And they also have a wealth of information online. Many of those resources for both of these websites you can order or download the information straight to your computer. I did want to